Welcome everyone. Again, my name is Cindy Comerford, and I'm the Climate Program Manager for the San Francisco Department of the Environment. And as many of you know, we're in the process of updating our climate action plan. And this workshop is really an opportunity for you to learn about how San Francisco is updating the plan. And we also want to learn from you and get feedback on the development of this plan. So tonight, the focus of the workshop is on climate and health. And it's really important for our audience to know that climate change is not solely an environmental issue. Climate change is really one of the greatest public health challenges of the 21st century. And this ranges from indirect impacts from how climate change is increasing transmission of pathogens to humans, and also direct impacts such as extreme heat exposure. So I'm very excited this evening to introduce our keynote speaker. This is someone who has been a mentor to me and I've had an opportunity to work with for many years around the root causes of health impacts and health disparities. So I'd like to introduce Dr. Linda Rudolph, who has many roles, but one is as the director of the Center of Climate Change and Health at the Public Health Institute. Linda?
Thanks so much, Cindy. I'm really pleased to be able to join this discussion today, and I'm also eager to hear all of your comments about what we can do to address climate change in San Francisco. Next. So I'm going to focus on 3 points. The first, Cindy already alluded to, that the health impacts of climate change are potentially catastrophic for human survival, and that climate change really is our greatest challenge of the 21st century from a health perspective, COVID-19 notwithstanding. Next. The good news is that climate change also represents an incredible health opportunity, and I'll talk more about that shortly. Next. So climate change is a true public health emergency, and the reason is because we have a short window of opportunity in which we can slow down climate change and avert its most catastrophic effects, and those effects threaten our air, our water, our soil, our shelter, and our security. So climate change threatens the things on which humans really depend for our survival. But if we build healthy energy systems, healthy transportation systems, if we change our land use and agriculture systems, we can deliver immediate and sustained health benefits and simultaneously reduce the future health risks of climate change. But we have to make sure that we do that in a way that doesn't leave anyone behind, particularly because climate change disproportionately impacts disadvantaged communities, communities of color, and people that are already vulnerable to the impacts of the environment on health. So we have to make sure that we center equity in climate action. So that's basically the key points I want to make tonight, but now let's go into it in a little bit more detail. Next. We all know that the causes of climate change are really the way that we move around, emissions from our transportation vehicles, how we heat and light and cool our homes, what kind of energy we use, and whether we use clean energy like from renewable air and renewable wind and solar, or whether we use dirty energy from fossil fuels like coal, gas, and oil, how much we consume, what kind of foods we eat, and what kind of built environments we make, whether we have, concrete jungles or whether we have places that have trees and access to green spaces and nature. Those same systems are what really drive health outcomes in our community, because these sources of greenhouse gas emissions are also sources of air pollution and water pollution, and unhealthy foods, overly processed foods, too much meat contribute to the climate changes, but also contribute to unhealthy diets that cause chronic illnesses and obesity. Next. We know that the living environments that so influence our health outcomes aren't equally distributed, that we have neighborhoods that have clean and healthy environments and others that are more polluted and offer less opportunity for access to health resources. And those differences in the environment drive huge disparities in health outcomes, with zip code life expectancies sometimes differing as much as 10 to 15 years, even a few BART stops away from one another. Next. I'm going to skip the next couple of slides, so please go to the next one, and the next one, and the next one. Those same differences in the environment are what really make different people in different communities more vulnerable to the health impacts of climate change. So I'm going to give a few examples of that climate gap, as our colleague, Dr. Rachel Morello-Frosch, has referred to it. Next. Take extreme heat. So a lot of people don't realize that extreme heat is actually the natural disaster that causes more deaths in the United States than anything else. Urban heat islands create temperatures that can be about 22 degrees Fahrenheit warmer than other areas. And an urban heat island is an area that doesn't have enough parks, doesn't have enough trees, doesn't have enough shade, has a lot of dense housing, and has a lot of pavement that and other hard surfaces that essentially soak up heat. And you can actually map urban heat islands to areas of historical residential segregation, poverty, and they're more common in communities of color. We also know that people that have pre-existing chronic diseases like cardiovascular disease are at higher risk from exposure to heat, but that people are more at risk of those chronic diseases if they live in areas that have a lot of air pollution. And we know that people that do outdoor work, like farm laborers or landscape contractors, are also more susceptible to extreme heat. And finally, people that are afraid to turn on their air conditioning or can't access air conditioning because of economic concerns are more vulnerable to heat. So this all comes together when you look at a fact like the fact that African Americans in Los Angeles are more than twice as likely to die in a heat wave as other residents. Next. You can see the same thing in extreme weather, and I'm not going to go through each of these in a lot of detail just because we want to move into your discussion of the climate plan. But we know that low-income households often lack disaster insurance. Undocumented immigrants can't get disaster assistance. Tribal communities are more vulnerable to the impacts on fisheries and farming. You know, we see problems with emergency preparedness messages often being provided in English only. So whether it's extreme flooding or drought or sea level rise, we see that people in the most disadvantaged communities are more vulnerable to the impacts. Next. One more example, people that work outdoors or people that have poor housing or that live near blighted and vacant properties are more likely to suffer from vector-borne diseases. And we know that climate change is exacerbating vector-borne disease because it's changing the habitat and spreading mosquitoes and ticks into areas that we haven't previously seen them. Next. So we're in the middle of a COVID pandemic, and I think it's just really important to point out that many of these factors that are contributing to climate health vulnerability are also contributing to COVID vulnerability. So people that have pre-existing cardiovascular or respiratory disease or obesity are more likely to get severe COVID disease or die from COVID than other people, just like people that have pre-existing cardiovascular disease or obesity are more susceptible to extreme heat. And you can track this all back to the kind of living conditions that we have in our neighborhoods. Next. So you can go on to the next slide. So when I think about what can we do to prevent climate-related health impacts, I also think about how can we make sure that as we're addressing climate change and reducing greenhouse gas emissions, we're also addressing these fundamental root causes of health inequities in our community. And many climate actions actually bring these huge health benefits, as I mentioned. So I'll just give a few examples of that. We know that air pollution from dirty buses and dirty diesel trucks and dirty cars and dirty energy cause a variety of chronic illnesses, including respiratory disease and cardiovascular disease, but also adverse birth outcomes. And we're seeing more evidence emerge about how air pollution, especially particulate matter, also contributes to cognitive decline and poor neurological development in very, very young babies. If we can transition to clean, safe, renewable energy and increase our energy efficiency, we can reduce all of those adverse health outcomes. We can employ people in those emerging industries. We can reduce fuel poverty, and we can create healthier homes by reducing indoor air pollution from the use of dirty fuels. Next. Zero emission vehicles are another way that we can really, are one of the ways in which we can reduce air pollution. And we know that people that live near busy roadways where there's a lot of emissions from vehicles are more susceptible to asthma, cardiovascular disease, and premature death. Next. Probably one of the best things we can do to both reduce greenhouse gas emissions and reduce adverse health outcomes is shift from our vehicle-centric transportation system to active transportation, walking, biking, and transit, because physical activity is very important in reducing the risks of heart disease, stroke, diabetes, obesity, depression, osteoporosis, and some cancers. Next. And in fact, studies that have been done in the Bay Area and in Southern California, this actually shows Southern California, show that if people would walk and bike just about 15 to 20 minutes a day, getting where they need to go, we would see a reduction in cardiovascular disease and diabetes of about 12%. That's a huge decrease. It's kind of akin to what we've done in reducing deaths from the use of tobacco. Next. I mentioned heat and urban heat islands. Not only will urban greening and planting more trees and creating more shade prevent heat illness, but it also alleviates flood risk. It helps clean our water and it helps clean our air. Greener spaces provide opportunities for physical activity and social interaction, and they're really good for our mental health. Next. I also mentioned our food system, and we know that a massive amount of food, about 40%, goes to food waste every year in the midst of incredible food insecurity. And our food production accounts for a lot of methane emissions, which is a very high potential for rapid global warming. We also know that our unhealthy diets contribute to chronic illness. So if we can move toward healthier diets and healthier production systems and less food waste, we both get health benefits and reduce greenhouse gas emissions. Next. So my real take-home message is that there's many things that we can do in the way of climate action that reduce the risks of climate-related illness, but also can reduce our underlying health inequities and reduce the chronic disease burden that accounts for about 80% of our healthcare costs right now. And that means we have to focus our climate action on simultaneously reducing carbon and methane and other greenhouse gas emissions, and on building climate resilience. And climate resilience for me really means we need to think about how can we bounce forward, or when we're talking about rebuilding after the COVID debacle, how can we build back better? How can we use climate action to change the social, economic, and environmental structures in our cities so that we promote health and equity, and we create systems changes that promote health and well-being. And since I believe that we can only do that by offering the people that live in the places that are impacted an opportunity to really share their knowledge and their wisdom in what it takes to transform these systems for health and climate resilience, it's thrilling to me to see the San Francisco Department of the Environment having these workshops to talk about the Climate Action Plan. And I will stop there. Thank you.
Great. Thank you so much, Linda. That was a wonderful presentation, and it plugs in so nicely to the work we're doing at the department. Our climate action plan really needs to be one about creating healthy environments that are really tied to reductions in health disparities. And as alluded to, we're all impacted by climate change, but we're not all impacted equally. And as we're kind of faced with these multiple global catastrophic occurrences around the coronavirus pandemic and racism and income inequality, along with the environmental consequences of climate change, we do really need to find a way to build back better. And our post-pandemic action plan needs to be a path forward. We see all these different disasters amplifying each other, and because of the urgency in which we need to respond to these multiple crises, it's also what our climate action plan needs to do. What also is really important is that we are harnessing the power of our communities and really creating a new paradigm around how we solve climate change, placing people in the middle. So next, I'm excited to introduce my colleague, Rich Chen, who is going to present on our process of developing the climate action plan and talk about the engagement that we're seeking this evening. Rich?